Thank you, Mr. Chair. Thank you all for being here. I'm going to start with the Better Healthcare for Albertans report as issued by the Auditor General, as well as talking about both some of the comments I've heard today, as well as some of the response letter that we received from government. So, without question, Albertans, I think, expect all parts of the healthcare system to work together. And as I asked in estimates, Albertans have a very limited understanding of these sort of silos that we've created. What is AHS? What is my GP's role? They think of themselves and their family and their own pathways to care. So, while I appreciate, Dr. Yu, that you feel in your initial comments that you've made some progress in implementing an integrated healthcare system, I can't help but note that there's a significant disconnect between your definition of integrated healthcare and the ministry's definition, as outlined in the response, and the Auditor General's definition of an integrated care. And I think probably the most noteworthy one would be the electronic health record seems focused on system as opposed to focused on individuals. So the question I have is, what evidence can you provide that shows your work is more close, the work towards a more closely integrated healthcare system will actually improve patient accessibility, experiences, and outcomes, and actually move in a tangible way towards the Auditor General's definition of an integrated care system?
So I can give you a number of examples, but I have a limited time, so maybe I'll start with a very recent one that really shows a very good continuity of care between primary care and specialty service. And you're absolutely right. I think when it comes to Albertans, what they really want to know is who do they need to go to, how do they get in to see their appointments. And I'll give you an example. So the gastroenterology group in Calgary actually worked with the primary care networks. They had a waiting list of about 2,700 patients. The wait time was too long, obviously, for most Albertans. And in working with PCN, streamlining of the referral system, they developed a health link call, which allowed patients to be streamed through the process of the referral. And they went down from a wait list of 2,700 down to 27 patients. That is an integration. I mean, that would not have happened if we didn't have primary care physicians working with specialists, using the AHS processes and systems around central intake to actually process that. So that, for me, is a very recent example. It was actually in the media a few months ago, and we can provide more information, but that's one example. Another example that I can give you is really around the CIS piece, and you're absolutely right. The Connect Care Clinical Information System is a tool, and that's all it is. It is an electronic system. But what it is going to allow us to do is it's going to allow us to transform care. It is really about actually enabling our people to do work differently that allows for better communication, not only between themselves, but also between patients and Albertans with their care teams. And that's going to be the power of the tool. As I said, it's really going to change the way that we work things. So that's just two examples.
Thank you. I appreciate that.